As dentists, we want to get our patients healthy, but sometimes the biggest obstacle in the way of the patient getting healthy is us. We have to convince the patients that they need and want the treatment. Some people would say we have to sell them, but I don't think of it that way. Think about this. If you were a heart surgeon and you discovered a blockage, you would tell the patient, hey, Mr. Jones, you need this surgery. And I think you would experience nearly 100% case acceptance for that procedure. But why do dental procedures only see a case acceptance of about 33%? Well, if you have a blockage and you don't get the procedure, what could happen? Well, you could die. If you have a dental problem, one that you can't see visually, and two, it doesn't even hurt, what happens if you don't get the procedure done? Do you die? No. Often nothing happens until the problem gets very far progressed. So as dentists, we're trying to get our patients to do procedures for problems that they can't see and that don't hurt. And if they don't do anything, they're not going to kill them. So we have to treat it differently. If we want to help our patients, we need to do everything we can to help them say yes. And that is what I'm going to share with you in this video. For those who don't know me, my name is Dr. Paul Etchison, and I am the host of the Dental Practice Heroes podcast. I'm the author of 2 books on dental practice management, a dental coach, and the owner of a large group practice in the south suburbs of Chicago. My goal is to teach you how to practice less days, make more money, and live a more fulfilling life, all the while taking amazing care of your patients. Now let's talk about case acceptance. We are not selling. We are helping our patients say yes. And if we can't get them to leave the operatory thinking 2 things, 1, that they like and trust us, and 2, that they want and need the treatment, the case is DOA by the time it gets to the front desk for financial presentation. We need to change the way we approach our patients so that they can say yes. Have you ever had a friend ask you if you could do their dental work and then they let you know that they don't want a discount? What they are saying is that they don't want to go to you because you're the cheapest and you're going to give them a discount. They're really saying they want to go to you because they trust you. Trust is super important when it comes to the dentist-patient relationship. So how can we build trust as fast as possible? Here is the easiest way. When you walk into the room, bring that positive energy and introduce yourself enthusiastically to the patient. Shake their hand confidently, look them in the eye, make that eye contact. Then I want you to sit down, and before you talk about anything dental, I want you to find 3 links. Here's what I mean by this. Find 3 things that you have in common. Ask the patient questions, personal questions. Get to know the patient on a personal level and share things about yourself as well. Don't start talking about anything tooth-related until this is done. Now, I know this may seem hard to believe, but nothing is going to help your case acceptance more than this little tip. You need to build rapport with the patient. You know those patients that when you walk out of the consult room, you say, man, I just crushed it. That patient's going to say yes to everything and get all that treatment done. Those are the patients that I guarantee you had rapport with. And it just came naturally because you have things in common with that patient and you just hit it off easily. But I want every single patient to feel like that, even the ones that you don't have much in common with. So I want you to ask questions, get to know your patient on a personal level before you talk about anything teeth. Next tip. Now, often in dental school, we're taught to educate the patient because if they know what we know, they're going to have to say yes to treatment. Because why wouldn't they, right? They're going to understand why everything is needed. But I hate to break it to you, it doesn't work. We're also told by consultants to talk about the benefits of treatment and not the treatment itself. Patients buy the benefits, not the treatment. Wrong again. This won't get any more patients saying yes to treatment either. The way to get our patients to say yes is to stay in the problem. We must talk about the problem and what's going to happen to the patient if they do not get treatment. For example, what's going to happen if they don't get a filling completed? Well, eventually it's going to need a root canal and cause them a bunch of pain, right? So, Mr. Jones, you have this decay here. We need you to take care of this with the filling because if you don't, this is going to turn into a root canal and cause you a lot of pain. We can fix this tooth easily with a filling, just like that. Now, what about fractured marginal ridges? What happens if we don't treat a fractured marginal ridge? Will it eventually break? What's going to happen? Yeah, eventually it will. And it may break clean. It might just need a crown after that. It may break into the pulp chamber and need a root canal, or it may break down that root and it needs to come out and we have to replace it with an implant. So tell Mr. Jones that. So, hey, Mr. Jones, we see this fracture in your tooth right here. And just like a crack in the windshield, it's going to break. It could be in 6 months. It could be at lunch today. We have no idea. But if we let it break, it may break through the pulp chamber and require a root canal, or it could break down the root surface and require an extraction or an implant. If we can get a ceramic crown on this tooth today, we can prevent it from fracturing any further. Easy peasy lemon squeezy. That's all you have to say. Stay in the problem. Don't go down the rabbit hole of explaining all all these different things and showing the patient how smart you are, just tell them what will happen if they don't get treatment. All right, let's move on. Remember we talked about how important trust is in dentistry? Who do you think the patients trust more, the dentist or the dental hygienist? It's the dental hygienist. There is always going to be some level of doubt among dentists, no matter how ethical we are. It's just there and we have to accept it. Now, here's how we can use that to our advantage. You, as the doctor, should always be the second opinion. Now, here's what I mean. I want you to work with your team and help them to understand and be able to see what you see as a doctor and tell the patient what you might recommend to the patient. Now, remember, team members and hygienists and assistants, they can't diagnose legally, but they can share what they think you might recommend. So when you come in, you become the second opinion. You're going to get much better case acceptance this way. Think about the way you're probably doing it now. The hygienist spends like an hour with the patient, doesn't say anything about any decay, any fractures, or any needed treatment, and then you walk in and tell them all these things are wrong. Now the patient's thinking, how did this person spend an hour in my mouth and not mention any of this stuff? Now, what does that patient do as soon as you walk out of the room? They look at your hygienist and they say, do I really need all that stuff? That's you being the first opinion. Now, if you can work with your team so that they're the first opinion, now you just come in as the second opinion. You confirm or you reject what they already talked to the patient about. You don't have to spend as much time even talking to the patient, because when you are the second opinion as the dentist, there is so much more trust and you're going to get better case acceptance. So in order to do this, you have to train your team. You have to look through cases together. You have to show them what to look for. They have to understand the way that you diagnose and how you treat your patients. And I mean, this only takes a few meetings here and there, working through, you go through some patient charts, you look at some x-rays, you look at some photos, and you say, hey, what do you see? How would you explain this to the patient? This is what I see. This is what I would say to the patient. And you keep going through cases together until you're on the same page almost all the time. Now, if the hygienist says something and you don't agree with it, then you just disagree. If the hygienist says something and you do agree with it, great, you're both on the same page. It doesn't make a difference, but you're going to get better case acceptance if you as the dentist are the second opinion and if your team is the first opinion. Now, we are dentists. We are healthcare providers. And if our patients don't say yes to our recommendations, our patients don't get healthy. And if we want them to get healthy, we have to present in a way that helps them to say yes. You need to build trust and rapport by getting to know the patients before you start talking about teeth. You need to stay in the problem and talk about what's going to happen if they don't get the treatment done. And last, you need to work with your hygiene team so that they can be the first opinion so you can be the second. If you do those three things alone, you're going to massively increase your case acceptance. And if you want more case acceptance training or more training on every single aspect of practice management, check out my website at dentalpracticeheroes.com. And if you like this video, please subscribe to the channel and check out the Dental Practice Heroes podcast for more tips on how to run your practice better. Thank you so much for watching, and we'll see you next time.